Well, doctors are changing the way they treat patients diagnosed with breast cancer.
Here's Latrice Curry with Eye on Health.
Well, David and Cindy, this news follows the finding of a 9-year study we recently told you about, that not everyone needs chemotherapy. One local doctor says this is a major game changer and gives her a much clearer picture when it comes to treatment for her patients.
This is a huge study that we've all been waiting years to hear the results of.
Dr. Witherspoon is the medical director for the Erlanger Center for Breast Health. She says those results show that doctors can now spare about 70% of patients from having to undergo chemotherapy.
For this group of women in this middle ground for their oncotype testing, that they do just as well with only the hormone blocking pill and no chemotherapy.
But up until the findings of this study were released, doctors couldn't say for sure whether chemo actually helped patients or not.
This is a huge piece of information that overnight has changed everyone's practice.
This year, about 260,000 new cases of breast cancer are expected in women across the United States, and the majority of them can most likely avoid chemotherapy. Dr. Witherspoon says while chemotherapy can save lives, it has serious risk.
In the short term, women frequently lose their hair. They may feel ill, fatigued, achy. They may get loss of sensation or pain in their fingers and toes, and sometimes that doesn't go away.
Dr. Witherspoon says she also worries about the long-term effects on the heart.
It's a pretty serious decision to decide to pursue chemotherapy, and now we're going to be able to avoid, numbers-wise, a large number of women even having to face that.
Well, while this is certainly good news for breast cancer patients, there are some who will still need to undergo chemo, such as patients diagnosed with the more aggressive forms. And in some cases, we're talking about patients, they say a lot of times younger than 50, because in those patients, it's more aggressive as well. So Cindy and David.